Okay. Welcome, everyone. I am Megan Mitchell, and I am excited today to bring you a clinical conversation for our continuing education platform. And today I am here with Maeve McMahon. She is also with us at Agents of Change. She is our community manager, and we're just going to have a discussion about school avoidance, school refusal, and truancy. So today we are talking about a topic we see a lot in our clinical practice. So we will be talking about from home to homeroom, facing the challenges of school avoidance, school refusal, and truancy. So I'm not going to read you my bio, but a little bit about me is I am a psychotherapist with children and adolescents, and Maeve is a pediatric behavior health clinician. So we thought this was a really important topic because we are seeing school avoidance, school refusal, and truancy a lot in our practice. And a lot of times parents don't know what to do, clinicians might not know what to do, and the school might not know what to do. So we are going to have a conversation about how we can support our clients who might be having or experiencing any of these behaviors. Okay, what will be our learning objectives for today? So after this, you will be able to identify the psychological, social, and academic factors contributing to school avoidance, school refusal, and truancy. You will be able to define school avoidance, school refusal, and truancy. And then you should be able to generate 3 to 5 strategies to help students experiencing school avoidance, refusal, and truancy transition back into the school setting, because we do want you to leave with some tangible strategies and resources that will help you in your practice if you do have some school avoidance, school refusal, or truancy cases. And then, why is this topic important? It's important because you might see it in your practice. If you work with young people that are of school age, you will most likely have a case of some sort of school avoidance or school refusal. The severity may differ. And those students or young people that are exhibiting some of these behaviors often have challenges. They might have academic challenges because they fall behind. They might have social challenges because they might have missed those social opportunities with their peers, and they might have emotional setbacks. They might experience shame or embarrassment when they do try to transition back into school, and this can affect their well-being in school and outside of school. And school refusal usually is a symptom of something more going on. There's usually anxiety or depression or bullying or a learning difference. Something's usually going on that more people need to be involved, right? Most kids don't, I mean, yes, we sometimes say, I don't want to go to school, right? That there's a normal spectrum of what would be appropriate. And then there's those that really have such severe symptoms they cannot get to school. And why else is this important? Because as professionals, we want to make sure that we are having a comprehensive and collaborative approach. So Maeve and I, we work very closely with a team of people. It's going to be working with the parents, working with the student. You definitely need to tap in the school. You got to figure out the best way to do a wraparound approach with the student to ensure that everyone's on the same page, and that's at home, school, and in the therapy setting. So let's go ahead and jump in. So Maeve, let's kick it off with this saying. What do you see in your practice? Who do you see? What is the ages? And are you seeing school avoidance, school refusal, and truancy with your caseload?
Yes, so I'm a pediatric behavioral health therapist. So the kids I typically see in my practice are between 12 and 18. So I would say they're middle school to high school, mostly high school. And there's definitely a lot of school refusal, especially recently, I think with the transitioning back into in-person school. There's been a lot of avoidance and struggling just to get the kid to school. So I've definitely been seeing it more frequently. I will say I personally have been seeing it more with my female patients as well. And typically they do have a diagnosis, I would say, most often of either anxiety or depression, but there's definitely other things that can play a factor as well.
Yeah, I actually am seeing it a lot with middle schoolers. I would say mostly just in my practice. And it has been challenging since the return from COVID. I think this population experienced a lot of that turmoil of in and out of school during really important years. This
Hmm.
is like their later elementary into middle school. So they really are struggling to adapt to school. And I would say last year and this year were really the first school years that were the most like quote unquote normal, where they were
Hmm.
actually back for the entire school year.
Hmm.
So yes, I'm seeing that too. And it's no surprise here. This was a study done in 2022. So COVID was already a mist, but school refusal behavior affects between 1 and 15% of youth. So if you work with youth, everyone out there, you will probably see a case of school refusal behavior. And that's what it's referred to in the literature, SRB, school refusal behavior. But we're going to talk a little bit about what the differences are, because there's different levels. It's not that everyone's going to have the same severity of school refusal behavior. So there's school avoidance. And this is kind of a broad thing. And it's exactly what it sounds like. These are students, kiddos, young people that are avoiding going to school or avoiding staying all day. I see that too. They might go half day and then they have a stomach ache. Oh, please come and get me, mom. Or I can't, I need to come home early. I need to go to school late. Those variety of things. So that can be tardiness, truancy, and school refusal. There's something that they're avoiding. So that's kind of the big bucket thing. That's school avoidance. Do you see different severities with your patients too, Maeve?
Yes, definitely. There's definitely the kids who just struggle to get there for like first and second period, and they are like failing just that first and second period, but then once they get to school they're fine. There's the kids who will get to school and call mom at lunchtime and be like, I need to be picked up. And then there's the kids who just will not show up, and that's typically when the truancy comes in.
Yeah.
And it actually becomes I mean, it's all a significant issue, but it becomes more of a known issue, especially with like the parents getting involved.
Yeah. So school avoidance is like we said, kind of that big umbrella, and then there's school refusal. And there's actually a difference. School refusal is like level 2, and then truancy is level 3, we'll call it.
Hmm.
School refusals when they're distressed, their anxiety, their fear, like the thought of going to school, they are refusing to go. So these are our kiddos. Like parents might be calling you as a clinician and saying, "What do I do?" They're I'm not going to drag my 15-year-old into the car, and that's ridiculous. They might actually have physical somatic symptoms. They're feeling nauseous. They might be shaking. Our younger ones might be tantruming, right? Having these big meltdowns because their nervous system is so activated at the thought of going to school that it's causing them to go into crisis mode, is what I say with parents. I say they are completely in crisis right now.
Hmm.
And usually there's different underlying issues. Like you mentioned, there might be separation anxiety. So it's really hard to leave mom or dad or caretaker. Generalized anxiety, just worries about everything. Well, I have a test second period, so I can't go and I didn't study enough. I see that a lot with some of my kiddos that are very high performers, actually. They fear that they'll perform poorly, so they'd rather just not go to school at all. Social phobia, if it's really hard for them to engage in group work. I have some kiddos like that. It's I don't want to go because I'm avoiding this person that I maybe have conflict with. And then depression, right? It can actually be very difficult to get up in the morning to find that energy to go. So that's school refusal. But usually with school refusal, parents know, right? That parents want them to be in school, but parents are also kind of stuck as well. Truancy is when it gets a little bit more tricky because this might be some of our older kiddos where they're having unexcused absences. The parents might not, they might, get to the building, parents drive away, or they take the bus or something, and they're not going into the school building. So the parents would not even know this is going on until they get a call from the school saying, where's your kid been all week? And they're like, what do you mean, where's my kid been? Also, sometimes parents go to school before the kids, and the kids are expected to get to school on their own, and so they don't show up. And truancy can be because of an underlying issue, but it also can be from other issues too, right? It could be peer pressure if they're truant, right? Maybe a bunch of them are skipping class. And this could be that there's other issues at home that need to be addressed. But it usually does not stem from emotional distress about attending school, but it definitely can. It's not so much a phobia of attending or a separation anxiety thing. There's probably some reason why they're not engaging. Maybe it's school's hard for them, right? And they're just not motivated. Maybe no one's following up with them and they're not engaged. Maybe they don't have a close contact at school that's really pushing them through. So, all three different, I would call them levels of school avoidance, school refusal, and truancy. We want to loop parents in at all stages. We don't want it to get to the point where they're truant, because we know that if they're in public school, you got to be in school or there's consequences. You might have to repeat the grade. At least here in Washington, D.C., I don't know if in Ohio, if you miss a certain amount of days of school, it's an automatic referral to CPS for absenteeism.
Yeah, there's a few school districts here that will fine the parents too.
Oh, find them. Okay. See, so it's all state to state. So I will say, check with what your state is. And like Maeve said, some parents are getting fined, right? That their kids aren't going to school. So just all important things. I have worked in with some private schools, and they've said your kids have missed so much school, they're not going to be offered a seat next year. Like that could go to someone else that is willing to come to school. So there can be consequences, and that's why parents have to be involved. Because we know that if they're not in school, that's where the problem starts to snowball, right? They start to miss more school, then they fall behind, they can't catch up. And then that we might be talking about failing. Kids might start to discuss dropping out, those type of things. So it's really important that we get ahead of it before. Okay, we're not going to get into the interventions yet, but we will get into some of the interventions. But Maeve, how do you handle, does a client often come to you and the presenting problem is the school refusal, or they come to you for maybe an anxiety depression diagnosis and then you start to see, oh, they're also not going to school? Because for me, what I've seen is they go very much hand in hand.
Yeah, typically I'll get the referral and the reason for referral will say either anxiety or depression. And then when I'm doing their intake, I get like a full like wraparound grasp on what's going on in their life, and that always involves school because it's pediatrics, and then that will kind of be when it comes up. Or if it's something where I start to see the patient with like mild depression or like mild anxiety or something like that, and then it doesn't start to get better and it actually starts to get more severe, then the school avoidance will kind of like develop as we're going.
Mm-hmm.
And typically that has to be brought up by the caregiver. It's not always brought up by the patient.
Right.
Because they know it's an issue, so they don't want to have to solve it.
Yes. I have seen the same thing too, and I'm starting to see it more now that we're in mid-October. School has settled down, the honeymoon period's over. A lot of my students that I see had a very strong first couple weeks because it was new, it was different, like things were moving pretty quickly. They could, have enough variety in their day. But now the homework's getting harder. Things are picking up, grades are coming out. So I'm starting to see it happen a lot more than it did maybe in the first couple of weeks of school as well. And if they're having some of those negative peer relationships, they're starting to shake out a little bit too. Social dynamics are starting to settle.
Yeah.
For our high schoolers, there's homecoming dances and a lot of school activities that are causing distress for some of our students too, that really are leading to an increase in anxiety and depression. When your patients come in, how do you think family dynamics play into the behaviors that you see if they aren't going to school or they're coming home early? How does the parent dynamic work, and how do you engage parents if you have a case like this?
Yeah, I feel like parents have to be engaged because the child is not going to force themselves into it, and they need that regulation at home. So I don't think I've ever had a successful case where a parent's not willing to be actively involved or follow recommendations, I should say. They are there because the child needs a caregiver, but it's tough when the parent isn't following recommendations because the kid's not going to just do it themselves in most cases. They need someone there to kind of support it. So if the parent's being an enabler, then it's typically going to just continue to get worse. So what I mean by an enabler is if they are going and picking up the kid every single time, or if they're letting the kids stay home and just stay in bed all day and scroll on their phone and be comfortable at home, or just not communicating with the school or the teachers or anything like that. So I think in the successful cases, the parents definitely have to be involved and very actively involved.
I agree with that too. And a lot of times, so I'm going to ask you the question that parents ask me all the time. Aren't I doing wrong by them by making them stay in school when they're distressed? I get that all the time. Oh, I feel so bad to make them go to school when they don't they're obviously in distress. So
Mm-hmm.
what would you say to a parent that obviously wants the best for their child but is saying I feel uncomfortable as the parent because they are having so much distress? I get that all the time. I don't know what to do. It just feels wrong to make them go when they don't want to.
I would say that if you look at the bigger picture, you're doing them more of a disservice by not fixing the problem now and letting the problem kind of just marinate. And it's going to become a bigger problem in the future if they fail a grade, get kicked out, or fail some classes and then have to retake certain classes. It's just going to become like it's going to kind of snowball into a bigger issue. So you're doing them more of a disservice by allowing them to avoid school to this extent.
And I think it's a reinforcing behavior because if a parent does say, okay, you can stay home today, I ask parents, what's going to happen tomorrow? And then what usually happens tomorrow? Well, now I can't go back because I missed yesterday and I'm so far behind. And then it's research shows it's harder to get them back the longer they're out. And I tell parents that I said, we need to really get ahead of this before it gets too big, because the longer they are out of school, the harder it is to reintegrate. And that's for a variety of different reasons. I get it. It's like, think of if you've ever had to miss school growing up. It's really
Mhm.
hard to make up that work, right? So a lot of times the problems actually just worsen. And I tell parents a lot, what they're avoiding is discomfort. Something about school is not comfortable, right? And it's causing a response for them, whether that be anxiety or fear of facing something.
Mhm.
They can do it. They can do it.
Right.
They can do it. They can do it. It's going to be uncomfortable and they might not like it, but we need to not fuel the anxiety by letting them avoid, because we know, right? Every behavior has a reason why they're doing it. Oftentimes they're not going to school because they're avoiding that discomfort. So I tell parents that by keeping them home, that gives them temporary discomfort. Yes, I'm in my home, I'm comfortable, this feels good. But in the long run, it's going to be harder, like you said, bigger picture to get them back in school. So it's really sometimes a lot of psychoeducation for the parents around what's going on.
Yeah, I think the phrase I always sound like a broken record in my office. I always say like they're uncomfortable, they're not unsafe. So
Love that. Yeah.
trying to, because I think parents are so worried about causing distress to the
Yeah.
kid, but reminding them that like uncomfortable doesn't mean danger. It just
Yeah.
means uncomfortable.
I love that. Uncomfortable does not mean unsafe. And that leads to a nice segue. Um, what do we do when our clients start upping the ante? So sometimes our teens say, okay, I'm not going to go. And then parents say, you have to go. They get there and then they're texting parents right away. I need to go. I'm feeling like I'm having maybe self-harm thoughts, or I'm going to self-harm. I see that a lot. They up the, and parents then say, oh my gosh, what do I do? My child's not safe. So what do you do, or what do you encourage parents to do when the kids up the ante a little bit because they know that they're going to get a reaction of some sort? So how can we help parents through those tough situations where they're worried now about the safety of their kids, because they nowadays kids have a lot of access to their parents. They're on their cell phones, which was not the case maybe 15, even 10 years ago. I was not allowed to have cell phones when I was in school, but some schools are allowing it, or kids are doing it at break times. They're finding they can even do it from their computers now, depending on that.
Right.
So how do you deal with that?
I think that there's varying levels because I do think that there's kids where school does trigger suicidal ideation or self-harm. And then unfortunately, I do think that there's instances where the kid knows that that will get a reaction out of the parent. Um, for the children who it's actually it's a really serious problem that they are triggered by these suicidal thoughts, these thoughts of self-harm, definitely putting safety first, of course, and making sure that the child is seeing a provider, has a safety plan in place, doesn't have access to anything that could harm them at home, that kind of thing. And some sort of, do you call them 504 plans in DC?
Yes,
So creating,
504 plan, some sort
yeah.
of accommodation. Yeah.
So creating some sort of 504 plan with the school where not necessarily if the kid is having a suicidal thought, but if they're sitting in class and getting very overwhelmed, like they can get up and leave the classroom and walk around in the hallway, take some deep breaths. So it doesn't get to that point of feeling like they can't keep themselves safe. They can kind of attack it at um the first sign of discomfort, and making sure that there's those accommodations that can get put in place. Every kid is different. Some kids need a quiet room that they can calm down in. Some kids need to just do breathing exercises in the guidance counselor's office. Some kids need to walk around. It kind of just depends, but I think that that definitely helps. For the kids that unfortunately can sometimes use this as like a manipulation tactic, I always say to take it seriously, and show them what happens if your safety is a threat. So if they're saying I'm going to hurt myself, I can't keep myself safe, taking them to the ER,
Mhm.
showing them what that process is like, showing them what it's like to implement a safety plan, so they recognize like the seriousness of saying something like that and not using it as a manipulation tactic again in the future.
Yeah, I think that's a really great a few really great ideas. So you definitely are going to have to collaborate with the school
Mhm.
because if the school doesn't know what's going on, they're not going to be able to keep
Right.
eyes on the student. So I always tell parents, I say, it's really hard, but we at some point have to put trust in the school too, right? So
Mhm.
that's why the school has to be honed in on what's going on. So hopefully there's a point of contact at the school, and if the client is feeling this level of distress, they can tell someone, right? Because we don't want something happening at school and, you know, that no one was aware that this was even occurring. So I always have them designate a point of contact or someone that they feel is a safe person. And I always try to make sure that if they are someone that is prone to self-harm, that they as much as possible there's eyes on them at some time. And in a school there generally is. Yeah,
Yeah.
no one's going to go to the bathroom with them, but if they are in the bathroom for a really long time,
Right.
like maybe someone from the school's like, okay, I'm going to go check because they've been gone for 25 minutes. And that's very common with school avoidant behavior, going to the bathroom a lot or
Mhm.
roaming the halls, just trying to do whatever to not be in the classroom. So that's just another piece of evidence that we need to provide some more support to this student.
Yeah, and I think it's also important that that kid is getting counseling services in addition to whatever safety plan is put in place. So I what I recommend and I kind of try and practice with my patients is if there's any sort of safety concern, no matter the level of suicidal ideation or self-harm, make sure that they're being seen weekly. And then you are a mandated reporter. So if a safety concern was brought up in your session, then the parent will be aware of it right away.
Yeah. That's very, very important. Safety first. And you have to assess what is the level of risk, right?
Hmm.
And this, like you said, they have to also be having some sort of outside support too. This is with these types of cases, they really are a collaborative approach. We're not going to make much progress if they're only getting services at school, they're only getting services through outpatient. It has to be everyone. And
Hmm.
parents have to be on board because if school is setting these things like you got to stay in class, and then they go home and parents don't have any sort of plan to manage the behavior, it's all going to be lost. So it really has to be, if there is a safety plan, what I usually do is schools have given me a safety plan. We all have a copy of it. I've had some parents put it on the fridge and talk about it before they go to school. So, they're prepared and they have the tools that they need to make it into the school building. And then if they are under distress, what can you do? What can you do? Um, Tell me a little bit more what your experience is with kids having access to parents via cell phone. Because for me, that has been a really big barrier is a lot of schools are allowing kids. So kids are very easily having access to parents or a guardian or a caregiver. And oftentimes parents very quickly give a response as well. So for me, that's what I'm seeing is that's fueling a lot of it is they're getting immediate response from parents as well.
I think it's important for a parent or caregiver to state a boundary with the patient and say, I'm not going to be answering your texts until after school hours. That way, if a child, and there's obviously circumstances where a kid does need to go home if they're sick or something, but in that case, the nurse is going to call the
Yep.
parents. And, or if there's something going on and a kid actually does need to go home, the office can call the parent. So there's really no need for a kid to be texting their parent throughout the day. Um, with a few exceptions, obviously. And I think it's okay for a parent to state that boundary. So I know that there's some guilt involved in that, but if you state the boundary, then the expectation isn't there. And I think then it's up to the parent or caregiver to uphold that boundary because once the kid gets one thing, they're gonna keep going, keep going. So I think the least amount of communication throughout the day, the better. I also think that a lot of kids will then start to rely on their caregiver for that. Even if they're not going home, they're relying on the caregiver for like the emotion regulation
Mhm.
of like, well, I need to talk to my mom because she's the one that can calm me down. But especially for like some of the older kids, like 16 and 17, they need to start to learn how to regulate themselves in those stressful situations.
Yeah, I agree. I like that you said they need to start to have some independence in using those skills because
Mhm.
oftentimes you will hear, well, I need to talk to my mom or I need to talk to so and so. They're the person that will help me. And when they are not in the school building, they may have access to parents, but that's not always the case, right? So in the world, they need to be able to deal with some of these distressing situations. And we know cycle of behavior when they're getting a response that's reinforcing that, oh, someone is going to help me through this.
Hmm.
And we can encourage parents to work on those skills at home. So then when they're at school, they can do them independently. But I similarly think that as little contact as possible for parents when texting and say, go see the guidance counselor, go do this. And then you kind of have to stop contact for a while because they could keep going and going and going and going until they break the parent down. I've seen it. It's like,
Hmm.
for so long the parents are just like I can't even go through this anymore. I'm just going to go pick them up because that's easier, right? And that is the case sometimes because parents have jobs and they're like I can't keep being disrupted with these calls all day.
Right.
So it can be a really slippery slope. So I agree the boundary has to be set and everyone has to be on the same page.
Hmm.
So if it's an emergency, you'll go to X person and they'll call mom and dad or a
Right.
caregiver. Or if you're sick, you go to this person, you go
Right.
to the school nurse and they'll take your temperature. But I also have to sometimes, not anymore, but when I worked in schools, we would also have to be mindful of how often kids are going to the nurse. There were
Hmm.
some very frequent flyers in the nurse's office, and that was actually an avoidance tactic. So the parents weren't even involved because the parents didn't know they were going to the nurse so often. But we, as a school team, started to see they're saying they have a stomach ache every
Hmm.
single day during math, right? Like what's going on here? So sometimes it's looping. If you all are someone that works at a school, as school staff also picking up on those behaviors, talking to the school nurse, talking to different people, talking to teachers, just checking in like what's going on, because I have seen a lot of students avoid different things by going to the nurse and spending the hour in there instead of being in class, which is school avoidant behavior. It's
Right.
not the same as not going to school, but it's avoiding something in the school day.
Yeah, and a lot of the times those kids are actually having some sort of like physical manifestation of the anxiety and maybe not as much with some of the older like kids who can identify emotions, but I think with the younger kids, I don't see a ton of younger kids, but the ones that I do, like this 6, 7, 8 year olds, if they're saying like they have a stomach ache, if you kind of look at the pattern of behavior, it's when they're feeling anxious or when they're feeling on edge about something. So they might not even be realizing like my stomach hurts because I'm anxious about this math test next period. But if you start to look at the pattern, then it kind of starts to poke out a little bit.
Yeah. And I work generally with younger clients than you do. I do work up to 18, but most of my kiddos are 5 to 15.
Hmm.
A lot of work sometimes has to be done, especially with our younger ones, is what happens in your body when you feel worried or scared? Because they might just be like, I'm scared. And I'm like, okay, what does that feel like? And they're like, scared. And I'm like, that's a feeling, but what's the sensations in your body? Does it feel like butterflies in your stomach? Does your heart start to beat? So that's an intervention that providers can do for preventative work, is helping them identify in their body what comes up when they're feeling distressed, right? Oh, your tummy's starting to feel like butterflies. Okay, that might mean that you're starting to get worried about something, or your heart's beating really fast. That could be a sign, right? So
Hmm.
a lot of identifying work so that they can, when they're in the moment and their heart's beating fast and they feel panic, they can identify that and say, oh, okay, I think that's my anxiety, or I think that's my worry. Because sometimes our little ones don't have the words and they don't know. It's really hard to be in touch with what's going on in your body and understand that there are actually somatic responses to the way that we experience certain events too.
Yeah, I don't know about you, but I don't think I've ever had like a 6-year-old straight up come in and say, like, I'm here because I'm anxious. Like they don't understand what that word means typically. So that's why I think what you just said is important.
Yeah. And it can feel really big and scary. I tell parents that. That's why we have to, for our younger ones, those of you out there that are working with younger ones, you got to find interventions that work on their levels. So maybe they're making a worry monster and they're feeding their worries into the worry monster, right? We're not just going to say, oh, come on in and tell me all the things that make you anxious day to day to a 6-year-old. They're going to be like, I don't know what that is. You got to also tailor your interventions to be developmentally appropriate, which is important for, because what a 17-year-old is going to need is very different than even maybe what a 13-year-old is going to need.
Hmm.
And that can be a big thing to discuss too. So that's actually a good segue into our interventions. So there can be, every kid is going to need something different, probably, right? It's not a standard approach. It's not that you do A and you get B, right? Every kid's going to be different. So I'm going to go through some of the main things and we can discuss how this looks in practice for both you and I. So I think the main thing, and we've talked about this a little bit throughout, is you have to mobilize the stakeholders. This is not done alone. You have to build those partnerships. And like you said, it's not really going to be successful unless your interventions involves the whole team. That can be hard, right? Because sometimes I worked in a school. Sometimes the school providers have huge, enormous caseloads, and it can be really difficult. So sometimes it is, I tell the kids sometimes you are not the only kid in the school. So you can't spend the entire day with the counselor, right? So we have to get ahead of some of these things that we know might be an issue and really foster these partnerships to make sure that throughout the day, I say even middle school and up, there's multiple teachers. So if it is 7 teachers that they see throughout the day, are all 7 teachers aware that this is going on,
Hmm.
right? So I think that getting a team involved is number one crucial step. Do you have anything to say about getting this team set up?
No, I think that's definitely number one. I think also keeping in mind if the child's therapist is not at the school getting that release so that they can communicate too.
Yeah,
I think is really important.
very important. Maeve and I work in outpatient, so we can't talk to school staff unless we have that release. So sometimes it's just nudging parents like, hey, I really want to communicate with the school and they want to communicate with me, but let's get this release signed. And sometimes parents are like, I don't know. And I'm like, I do psychoeducation then. This is not to label your child or punish them. We really need to all be on the same page to work together. It's not that we are doing this, just to do it. There's a purpose why we need to be communicating, because all these different environments do play together in the homeschool partnership. So I think that's number one, is you got to have stakeholders involved.
Hmm.
Then we know we got to have parents involved or caregivers involved. And there's a lot of different, I'll ask you in just a moment what therapies you use, but DBT might be used if they need some of those skills that are regular and they're practicing those regular. CBT might be a modality that they use. but parents also need to be involved to know what skills you are working on with the kiddo, right? So they can reinforce that. Like, are you using a breathing tool? Are you using, mindfulness? Are you using these different things? And usually results, I mean, research shows results are going to be better when parents are also on board and you have that good collaborative approach.
Mhm.
I actually am trained in space, which is a modality that works on parent accommodations. And the rationale behind space is that when parents pull the accommodations back, so accommodations would be things like picking the child up from school or being the first one in line so that the child, can ease that anxiety. When we pull those accommodations back and actually have the children sit with the discomfort, they can do it. So some of it is actually working with the parents and saying, I know this is so hard, but when they text you 15 times and it's not an emergency, we're not going to answer the phone. That's an accommodation. We're not going to make that accommodation. So I use a variety of different things, but one that I have really liked is that space training with parents. So what are some techniques or protocols you use with your patients, and then how do you involve caregivers in that treatment process?
I would say the two biggest ones would probably be CBT and mindfulness. Definitely working on the with CBT, reframing the thoughts, like trying to identify what it is that you're worried about that day, and then how your negative thoughts are kind of exasperating that. And then what happens when you reframe that thought. And then if you take it a step further, it's like, okay, well, what if your fear does come true? Like, then what's going to happen? And 99% of the time, it's like, well, I'd be okay. It would just be uncomfortable for that moment. Um, and then with mindfulness, definitely putting in some like deep breathing exercises that they can do. I like deep breathing because they can do it sitting in the classroom, like, and no one around them has to notice. Imagery, like muscle relaxation, that kind of thing. And then with all of those, the CBT and the mindfulness, I think making sure that the parents are aware, because then if the parent kind of starts to notice like some of that anxiety is creeping in about school, they can remind them like, hey, like, let's sit here and talk about it. Sometimes it helps to have, like, sometimes the kids do want to just talk it out, but if the parent doesn't necessarily realize like what CBT is, they're not helping reframe those thoughts, and they're not helping kind of like debunk the anxiety. They might just like feed into it or just say like, oh, it'll be okay, which isn't going to really help.
That does not
So
help.
yeah, giving them just like some of that strategy, and then like talking about the mindfulness activity so they can be like I think especially with the younger kids, like, let's sit down and do like an imagery exercise or something like that.
Yeah. And what's really great is a lot of schools have incorporated a lot of social emotional learning. So schools are really on board with it too. They might, for our little ones, they might have a calm down corner, or they might have a chill spot where the kids can kind of go themselves, and everyone does it, right? It's not, I love now how proactive schools are being with
Yeah.
making sure kids get the space to do that. So sometimes just reinforcing it. And I don't know if you see this, but I sometimes get kids saying, well, I'm embarrassed to do that. And that's why I like the breathing. No one's gonna, we all have to breathe. So no
Yeah.
one's gonna notice if you're taking a deep breath or you're doing some,
Mhm.
finger breathing or a variety of different things that you can do without having to leave the
Yeah.
classroom. So I try to tell, I mean, it's hard. Our teens don't want to be ostracized. They don't want to feel like people are, and that could be the fear that they're already having, is people are
Mhm.
going to laugh at me, or they're going to think that I'm doing this weird thing. Cause
Yeah,
that's,
there's some good apps too, like some CBT apps that some of my kids like that the older kids like that they can do. The first patient that I started like that's I thought of this for was she was school avoidant. She was getting better, but it got worse because her mom started working. So she didn't have a parent at home with her in the morning, and her parents were typically the ones that she could kind of like bounce her worries off of. Um, and so she didn't like not having someone to talk to in the morning. So we figured out, I mean, there's a variety of different CBT apps, and you kind of just have to figure out which one is best for you.
yep.
Um, but we found one that she likes, and it kind of just like walks you through like the different stages of CBT. So that would probably be more relevant for like a teenager that has a phone.
Yeah.
but that was helpful too.
Yeah, and I've even told parents like do a meditation as a family at night, right? Like before you go
Right.
to bed, make it part of your routine where you're all doing the body scan or you have white noise playing. So some families have like, and then that normalizes it for the kiddo, right? It's like, well, we
Mm.
all do it. It's part of our routine. So I've noted to parents too that apps can be really helpful. I mean, we're on our phones all the time, so
Right.
we utilize it for a positive experience.
Hmm.
We got to tailor the interventions to what's going on. So I know we've talked a lot about anxiety, but what do you suggest if a kiddo's being bullied? That happens a lot, or they're being, social media cyberbullied, and they're like, someone posted something about me last night, and now I can't face it. Or they do have that depression where it's just so hard to get out of bed. Like, how do you determine for maybe if it's not anxiety, if they're being bullied or they have some depression? What are some suggestions you'd give for that?
I think depression routine is key.
Yep.
So making sure that like especially sleeping and eating, I feel like those are the two that are kind of like the first to be stressed when a patient is depressed. So making sure that that's intact, but then also making sure like, okay, you're putting your clothes out the night before, you've packed your lunch, you've packed your bag, you've done your homework. Um, Making sure you're getting 8 hours of sleep, making sure that you're waking up and you can take your shower and brush your teeth. And then after school, you have an after school activity and you're not coming home and laying around all day. So definitely making sure that the routine is kind of implemented, because I think that's something that helps a lot of kids with depression. And then obviously making sure that they're getting treatment if necessary. I think especially with depression as well, and I mean any sort of diagnosis, if medication is necessary, making sure that they have a psychiatrist that they're seeing that they can get that medication from. And that can make, I mean, it's not for everyone, but there are some kids where it makes like a world of a difference. I think bullying is a tough one because I think it's gotten pretty bad, especially with social media. So I always say the first thing with if a kid is being bullied, and this is a tricky balance because you don't want the child to feel like they're being punished, but decreasing social media usage. So not sleeping with your phone in your room for a multitude of reasons. I mean, it's hard to sleep when your phone's right there. But also you don't want the last thing that you see at night to be someone's post on Instagram that made you feel badly, and the first thing that you see in the morning to be like a mean text. So decreasing phone usage, I think, is a big one. Um, Making sure that the school is involved. So if it escalates, then the school can kind of step in and make sure that there's penalties that are brought in. Um, and just monitoring the child's usage. I hate to keep repeating the phone, but that's typically where a lot of it happens. So you don't have to snoop around, but if you have concerns, making sure that you're monitoring that too.
And I think that just ties into so much too that there as parents, it's important if your kids are on social media, we're not saying don't do that.
Right.
Kids are on social media. That's the world that we live in. But teaching your kids that they have to have boundaries, right?
Mhm.
I have so many teens that I talk about what are your boundaries on social media? And they usually don't have very many, right?
Right.
And they maybe someone posted something they don't even know necessarily if it's about them, but their anxiety gets the best of them and they're like it's definitely about me. And I sometimes just push back a little bit and say is following this person bringing you any benefit? And they're like, well, no, but I need to know what's going on. So a lot of
Right.
times it can be that FOMO piece. So really helping them see both sides of the coin, like, yes, you have access to what they're doing, but is that benefiting you or is it hurting you?
Yeah, I have some kids with any sort of activity, but I think that social media is the main one that or the most common one, but kind of like keeping like some sort of journal or something of how did I feel before I did this and how do I feel after this? So social media would be one that is typically, sorry, it keeps going off in the background. The social media would be one that typically is a negative reinforcement. Like if they started to track their feelings on the behaviors, they would see like, okay, I don't usually feel good after I scroll on my phone for 4 hours. But then like an example of a positive, more positive one would be like, usually when I go on a walk and listen to my music, like I feel a little bit better afterwards. Not saying that that's going to cure your depression, but then you can kind of get more of an overall view on what's helping you, like what makes you feel good and what doesn't make you feel good.
Yeah, I agree on all that. Journaling's great for teens. Sometimes they will say, I don't journal. So I say, get out your notes app, right? They're on
Yeah,
that tab.
I say
Or
that all
they'll
the
do
time.
the tech, the voice, the text, the talk into the phone and it will capture
Mm,
it for them. That's a good thing too. Just get your thoughts out somehow is what I tell them, whatever that is, so that you
yeah.
can know what was triggering for you in that moment or what you need to do in the future. So I encourage them to at least get their thoughts out because it can be hard if from moment to moment, right? To be like, it's an awful day. And it's like, well, you wrote earlier in your journal that playing soccer was really helpful for you. So kind of just helping them track and journal and rate. Sometimes I'll have people rate their mood all the time. What's your mood when you wake up and what's your mood when you go to bed and what's your mood in the middle of the day? Because if I
I
ask them and they're not tracking that, they're going to say bad. It was bad. And I'm like, okay, but if you journaled it for me, I have some more. And then we can see trends and patterns and what's going on.
Yeah, I have patients rate their mood at the beginning of every session. So I'll say like rate your mood on a scale of 1 to 10 since the last time you saw me. Which sometimes is helpful, sometimes it's not, but it's there if you need it.
Yeah, it's just a tool. And like we
Right.
said, it's a tailored approach. So what works for one student
Hmm.
is not going to work for another.
Right.
So this is you will see a lot of school refusal stuff from an author named Kearney. He is kind of like the person that did all of this stuff. So this is a multi-tier model for school absenteeism. And this is just kind of what we were talking about. There should be different tiers, different levels based on the severity. So what should be happening for everyone is there should be something at the school level that is encouraging students to be there. I mean, I don't know a school that doesn't do some sort of attendance policy incentive program, and that they might be getting, mental health services. They might have guidance lessons. There's a variety of things, but that's just everyone should be getting that because that's good for our students.
Hmm.
Other things are like summer bridge programs. So that's sometimes if they're going into high school or they're going into middle school, they come in the summer to kind of get more acclimated with the setting so that they feel more comfortable. But then that's not going to work for everyone. Some kids are still going to have school refusal, school avoidance, truancy behaviors. So for that, there can be a variety of things. Maybe there's a teacher that's going to be a support to them. They check in and check out with that teacher every day. Or maybe there's a peer program and that peer is going to really like encourage them or text them like, hey, we're looking forward to seeing you at school today. Then of those students, 5 or 10% that like are still gonna need intensive tier 3, the highest level of support. And those are where we start to see that severe absenteeism. So this is where we definitely might need to have some more intensive supports. They might even need, I've had some students that need to do alternative learning. They're still getting credits, they're still being able to do it, but it has to be alternative, whether that be online or in a specialized, setting. And then sometimes they do need a higher level of care. So they might need a residential program or an intensive outpatient or something that is higher level than seeing an outpatient therapist maybe 1 or 2 times a week.
Hmm.
So it all depends. And the hope is that, you will work through these different tiers and you won't need the higher level, but there are definitely cases that do require a higher level of care than can be provided based on severity of symptoms. Okay. So if you're wondering, well, how do I know why they're missing school or what's going on? There's actually assessments out there. It's called the School Refusal Assessment Scale. And there are links here. There's a parent version and a child version. And it's really good to get both perspectives because it's very interesting to compare the different scores. There's 24 questions, and then whichever category, there's 4 categories of the function of the behavior. Whichever score is mean score is the highest, that's probably their primary function of why they're refusing school. And there's 4 categories of why they might be refusing school. Avoiding unpleasant situations or distress, right? So I'm not going to school because I'm avoiding that unpleasant feeling, right? I feel really comfortable at home, in my room, in my bed with my family. So I'm not going to school because it's distressing to me. And I want to avoid that feeling because it feels yucky. The second is avoiding of social or evaluative situations. So this could be if there is a presentation that you have to public speak at, or you have a big test that day and maybe magically that child is having stomach issues every single day there's a test. That would be avoiding particular situations, right? It's that test, that performance, that public speaking gives me so much anxiety that I avoid it completely because it's easier to just avoid. Then there's seeking attention for from certain people. So what that means is they're wanting an emotional connection from someone. I've actually seen some kids want the only connection they get from parents is when they do actually avoid school because the parents are having to give them attention. So sometimes we need to tease that out. What's going on? Are they seeking emotional connection, and or is school really or is home really a place where they feel safe, and maybe there's that separation anxiety or something, but it's very difficult for them to separate from the home to the school setting. And then you do often see the seeking attention from individuals in our younger kiddos, right? That separation anxiety, it's full-blown panic. I can't leave my mom. I need to, or dad or caregiver, I need to be with them right away. Then there are some kiddos that the function of the behavior is pursuit of rewards. So they don't go to school, but they get to play video games all day because maybe there's no parent home to watch them. Or I get to go home and sleep all day. I'm doing nothing. That's so much better than going to school. Or sometimes there are kids that are avoiding are doing other things, right? They're on their phone, they're doing social media, they're kind of doing whatever they want. I've seen some kids do that. So these are the 4 areas that could be a function of someone's behavior of why they're avoiding school, refusing school, or not going to school. And there can be multiple, right? It could be one's more present than others, but a lot of times they're interconnected too. So that I do encourage you all to check out that scale if you do have a case. It's really easy to score. It's very simple and you find the mean. And this just gives you a good starting point so you know what to address and where you need to go with your treatment plan. Okay, so we're to the fun part now. So Maeve is going to talk about a case and I'm gonna pick her brain and ask her some questions about this. And this is a school refusal case. So Maeve, do you want to tell us a little bit about your patient? And obviously names and identifying information have been changed, and this is just for educational purposes, but go ahead and tell us about your case study.
Yeah, so this is a patient I've been seeing for a while. She's a female, 15. Her diagnoses are major depressive disorder, generalized anxiety disorder, and ADHD, and a little bit of history. Sophia has had 28 absences so far this school year, which, if you think about how much school has gone on, including like weekends and general days off, that's a lot, majority of the days. She refuses to go to school in the morning. The most recent reasoning is if she doesn't like her makeup and outfit that day, she'll spend 3 hours getting ready, get up at 4 in the morning. But then at the end, she'll decide like, I don't like the way I look. Mom enables the behavior and allows the patient to stay home each day. And then when she stays home, she just lays in bed and does whatever she wants, watches TV, kind of just has a house to herself. Because, like you were saying, her mom works, so there's no one there to regulate what she's doing. Then there was another barrier added in a couple weeks ago. She went to school for the first time in a while, but got suspended for bringing a vape. And now her suspension was up this previous week, but she was refusing to go back because she didn't want people to make fun of her for getting suspended. So I definitely think there's a lot of different layers going on. There's definitely a confidence issue where the makeup and the outfits and the looks come in. There's the comfort of being in the home, kind of being able to do whatever you want all day. And then the added layer of there's definitely a bit of a substance use issue with the vape, but added in that she's embarrassed about what people might think, which also kind of ties back into the confidence.
So I want to go back to this slide. What do you think of these four functions of behavior might be going on for this client?
Definitely the last one, pursuit of tangible rewards outside of school, and then probably a little bit of avoidance of social or evaluative situations.
So now let me pick your brain. Is this the first year that this client has been having some of these issues, or is this an ongoing, like every year starting to have some of these things? What do you think might be fueling some of this confidence issues and waking up at 4 and then I don't feel like I look right and I mean very much developmentally appropriate at 15. Appearance definitely matters to kids. So what are some underlying things that you think might be going on?
So definitely the biggest thing, her boyfriend broke up with her in June. So it's kind of been an ongoing thing. Over the summer would get a little bit better, but in her words, school reminds her he moved away. School reminds her of him, and every time she sees a corner that they would talk in or a classroom that they had together or something like that, um she describes it as a feeling of anxiety when she sees it. That definitely fuels it a little bit. I think because she's missed so many days now as well, she's behind, so she feels stressed when she has to kind of catch up on those classes. The school avoidance hasn't always been an issue. The ADHD has been present with her since she was about 6. Um, and I think the depression and anxiety, I've been seeing her for probably 6 to 8 months, but the depression and anxiety have been around for probably about a year.
Okay. And I'm guessing she did not come to see you for school refusal. So when do you start, how, if I'm a clinician, how do I prioritize? Do I focus on the depression? Do I focus on the ADHD, not going to school? So that's obviously a big one right now.
Yeah, the depression, I think, well, she was referred to me for depression. And I think the biggest thing with that is if there's safety concerns, making sure that those are stable. So even if there's school refusal going on, making sure that you're prioritizing any sort of suicidal ideation or self harm. So making sure that the patient's like stable and safe before um, trying to attack anything else. So that's kind of what we did. Um, then we were over the summer a little bit, so that wasn't necessarily an issue as much, and she was doing pretty well. And then the school year kind of started back up. Sophia was definitely not the one to initially tell me. Her mom was the one that actually told me. And in Sophia's words, for a while, and I think this is why it's important to check in with parents, everything was going great. She was feeling good. Nothing was wrong. And then I had to check in with mom, and mom kind of told me everything. And then eventually Sophia kind of broke down and was like, okay, yeah, this is what's going on. So I think that kind of just emphasizes why it's important to check in with the parents too, because sometimes the kids don't want to change, so they won't be fully upfront.
And I've seen there's often an element of shame. It's like,
Right.
I don't want to tell you that this is happening because they oftentimes they do want to be at school, but now they're so far removed, 28 days. It's really hard
Yeah.
to, how do you go back after that? And then there's this incident where now I was suspended and everyone's going to be talking about me. And how do we integrate back into that? What would you encourage for a treatment plan to get school on board, to get parents on board, and to get client on board? And do you ever do a scaled approach where maybe we're just getting you there for half days, maybe we're working our way up? What would be a suitable treatment plan, do you think, for this case?
For this particular patient, because it's escalated so severely and it's really debilitating for her, what I would like to see her do and what I'm currently encouraging is some sort of outpatient program, like an intensive outpatient program. So I don't think that therapy once a week for an hour is helpful, because with this patient as well, she insists on doing virtual appointments and won't turn her camera on. And I think that there's just a little bit of a loss of emphasis that can happen then. And it's not an issue with therapeutic rapport. I really enjoy seeing this patient. I think that we have a good professional rapport back and forth. She respects me, which I think was a little bit of the issue to begin with, and why she didn't want to be fully upfront was because I was giving a lot of praise on her improvements, so she didn't want to tell me about like the pullback. Um, so what I'll probably encourage is doing some sort of IOP, which would be probably 4 times a week with a group. And then once she successfully finishes that, coming back and seeing me for weekly therapy. And I'll interact with the school and make sure that there's things in place for that.
Yeah.
Um, that's for this patient specifically. For another patient, what I would probably encourage is putting that 504 plan in place if necessary, so that there is some sort of safety, not safety if there's thoughts of self-harm or suicidality, but safety net in the patient's mind of like, oh, if I do get anxious at school, I can go take a walk or something like that. Another thing I tell a lot of my patients is just get in the car and drive to school.
Yep.
And then like you can kind of trick your brain into it, and it's like, okay, I'll get in the car because I don't have to get out necessarily. But then once you're there, you'll probably be like, okay, I'll just get out and see what happens. So at least just getting in the car and driving to school, I think, is a good first step.
Yeah, I agree. And I even tell parents, even on Saturdays and Sundays, getting in the car and driving to get in that routine, because weekends are really, really hard. Mondays are hard to get back in the routine. So you'll see a lot
Mhm.
of school refusal on Mondays. Interestingly enough, Fridays are actually difficult I'd say, it's the last day you can make it through, but the exhaustion starts to set in that like it was such a hard week, and what's one day gonna be? It just, extra day. So I
Mhm.
agree, just getting in the car, doing all those things as well is important too. And I'm really glad that you brought up a higher level of care. So if you are listening and you think that what you are able to provide is not enough, you definitely should have those discussions, because a higher level of care might be needed. And I have found that sometimes teens, I'm not going to say they enjoy IOP, but they are around other adolescents their age that are also going through something similar, and there's a lot of feeling that, oh wow, I'm not the only one going through this. So there can be a supportive aspect to it as well. And at the end of the day, we need to make sure what we're doing, what's in the best interest of the client, and if that is a higher level of care, we need to make those recommendations to parents. If they follow up on it, that, I mean, we can encourage, we can push, say this is our clinical recommendation. We can help them find IOPs, because the wait list can be long for some of those programs. But it is important to determine, does this client need more care than I can provide? So thank you for sharing that case, Maeve. Lots of interesting food for thought. And hopefully that everything we talk, I mean, we could talk about school refusal and truancy and school avoidance forever, but hopefully people are able to take a couple interventions away from this, right? We have the assessment scale that they can utilize. We talked a lot about building up those coping skills. You have to do a team approach. Maybe this involves getting the kiddo a 504 or some accommodations at school. And sometimes you just gotta really be creative, right? What's gonna work for that particular child? Going to school every day, even on the weekends. For some students, you might have them go for half a day and then they build up. It really depends. You can't say that it's what works for one student's going to work for another. But we do know the longer they're out of school, the harder it is to get back into school, which makes sense. So
Mhm.
I have our key resources here for anyone that is interested in some additional follow-up information. Like I said, there's tons of information out there. And this is an area that I think a lot of people struggle with, because they just feel helpless when it comes to school refusal. And I have definitely felt like, oh my gosh, what do I do? But it's really about leaning on that team for support, because you do need a team approach to be able to successfully integrate kiddos back into the school. So here's some of our key resources. But Maeve, I wanted to thank you for sharing your insight with us today. And thank you everyone for tuning in to learn more about school refusal, school avoidance, and truancy. Thank
Yeah.
you.
Thank you.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.